The broadcast is now starting. All attendees are in listen-only mode.
Great. So good afternoon, everyone. Thank you for being here on this Monday. Welcome to the Maricopa County press conference for April 13th from the Unified Command. I'm Phillips Mosley. I'm the lead PIO for the Unified Command, as well as the communications director for Maricopa County. So today's topic is going to be about medical care inside Maricopa County jails, and specifically dealing with potential COVID-19 cases as they are found in the jail. So Dr. Grant Phillips, he is our medical director for Correctional Health Services. This is the department that's responsible for medical and mental health care inside of our jails. So he will take questions after a brief presentation. We also have Dr. Rebecca Sunenshine, the medical director for Public Health Services as well. So members of the media, you will be called upon to raise your hand virtually in the webinar. We invite you to do that. You'll be called upon to ask your question. Please make sure your microphones are unmuted while you're in the webinar, and we will unmute your mic for the purposes of asking questions here. We can all hear your questions over a speaker in here, and that includes our subject matter experts, Dr. Phillips and Dr. Sunenshine today. With that, I'd like to welcome to the podium Dr. Grant Phillips.
Hello, I am Dr. Grant Phillips. That's GrantPhillips, and I am the medical director for Maricopa County Correctional Health Services. For those who are not familiar with our agency, we provide medical, dental, and mental health services for all individuals incarcerated within the Maricopa County jail system. Our team is made up of healthcare professionals who are passionate about providing quality healthcare in a unique environment. Our doctors, qualified healthcare providers, nurses, dentists, counselors, and other mental health staff, medical assistants, and many others are focused on providing the best care to each patient. These individuals are truly healthcare heroes, and I just want to thank them for their dedication to keeping our patients safe. Today, I'm here to speak about the planning and preventative measures we have implemented in response to the COVID-19 pandemic. As a healthcare provider who serves high-risk individuals every day, we understand and acknowledge the importance of managing and preventing the spread of communicable diseases in our facilities. To prevent or mitigate the potential spread of COVID-19 in any of the county jails, Correctional Health Services has been working closely with the Maricopa County Department of Public Health to implement a comprehensive infection control strategy to ensure that inmates who become ill are managed appropriately, including daily visits and ensuring separation from those who are well. As of Friday, April 10th, 28 patients have been tested. 21 tests have been returned as negative for COVID-19. We have 7 patients in medical observation while results are pending. Let me be clear, as of Friday, we have had no positive tests returned for inmates in our care. We are appreciative of steps taken by the courts and Sheriff's Office to reduce the number of individuals coming and going from jail facilities each day, as this has greatly reduced the risk of those living and working in those facilities. However, we understand that a complete quarantine is not realistic, and therefore we have implemented several proactive measures. These include staff are monitoring daily for fever and symptoms and being sent home if any develop. An inmate entering a facility undergoes additional screening at the time of intake to determine the presence of fever, respiratory infection, recent travel, or contact with persons who are known to be infected with COVID-19. Symptomatic inmates are being evaluated by a healthcare provider, placed in medical observation, and tested if their symptoms are consistent with COVID-19. In the event an inmate has a positive screening test for COVID-19, they will be rapidly triaged and transported to a medical facility if necessary. Inmates who are exposed to someone with laboratory confirmed COVID-19 are placed in quarantine and monitored for symptoms. Correctional Health Services remains vigilant in its efforts to use all available resources to maintain the safety and security of our patients, staff, and the public at large. We understand that for those with family members and loved ones in our facilities, this is a difficult and scary time. However, we are committed to providing high-quality, professional medical services to your loved ones, and we will use every resource at our disposal to protect those in our care. Thank you.
Thank you very much, Dr. Phillips. We'll now open it up for questions. Once again, Dr. Grant Phillips, he is the medical director for Correctional Health Services, the department that serves the medical needs and the mental health needs of those in our Maricopa County jails. Also, we have Dr. Rebecca Sunenshine here. She's the medical director for public health. So do we have a question?
We have a question from Jimmy Jenkins. Jimmy, your microphone is live.
Hi, thank you, and thank you, Field, so much for making this available to us. I've just been communicating with several people who are currently incarcerated in the jails, and I guess my question would be for the CHS doctor, but we're just hearing that the cleaning schedule has not increased and that pods are only being cleaned once a week, and that there's still a lack of access to soap, and that inmates have been provided a mask, but they're only getting one mask a month. So just wondering if you could give us some more details on what kinds of things are being done in the jails to deal with cleaning and disinfecting and that sort of thing.
Jimmy, I think we're going to have to try to get back to you on that. Some of those are crossover with services, vendors coming in from the outside and doing some of the cleaning and that sort of thing. And some of that information would be provided by MCSO, but I don't have anybody from MCSO here today. So we'll take your question and I'll try to get back to you on that.
Okay, how about while I have you then, can you tell us what hospital or would you be partnering with for the inmates that do need that advanced treatment that you mentioned?
Let me check with Dr. Phillips. He can answer that.
So thank you for that question. The question was about which hospital we partner with. When an inmate patient needs a higher level of care, we need to send them off-site for services. CHS partners with several different hospitals in the Valley. The decision on which hospital to send the patient to is oftentimes dictated by the acuity of that patient's medical condition.
Okay, thank you for the questions, Jimmy. Do we have another question?
Yes, we have a question from Brian Webb. Brian, your microphone is muted and needs to be unmuted before we can. There we go, Brian.
There we go. Sorry about that. Thanks, Fields. This is for Dr. Sunenshine, if you don't mind. Doctor, I was just going to ask if your numbers agree with the peak cases coming at the end of April or the beginning of May, and then what happens after the peak, and will we have enough tests to track this case by case versus going back to stay at home and strict social distancing? Thank you.
Okay, kind of a two-part question there. Do we agree with some of the modeling that's coming out, and if testing is part of the solution to understand whether or not we are going to have a second jump in cases? So I'll let Dr. Sunenshine respond to that.
All right, I'm just writing down both of your questions. Okay, first let me address the modeling that's available. There are a number of different models that are available, and as you're aware, Models are predictions based on sort of a best guess. So there's no way to really say exactly when the peak is going to occur. One of the main models that our federal agencies are using predicts that will occur in Arizona sometime in late April or very early May. And I understand what those estimates are based on, but it's impossible to really know. I will tell you that as we get more and more data, we're able to refine those models over time, so that model may actually change its prediction. We are very much preparing for that peak to come anytime in the next week to 2 weeks. And we're working closely with the state health department and the state emergency operations center to prepare for any healthcare surge that happens, including alternate care sites with extra hospital beds, ICU beds, and they've even placed orders for ventilators should that need arise. Regarding a second wave, it's just impossible to know whether there will be a second wave. We've never actually seen a pandemic of coronavirus before, never mind a novel coronavirus. So we do know that with influenza pandemics, there has always been a second wave. But in this case, our best thing to do really is to watch the countries that have experienced novel coronavirus before us, particularly China and other countries surrounding it. And if they experience a second wave, that'll be the best information to tell us that we're likely to experience one as well.
All right, thank you, Brian, for those questions. Do we have somebody else?
Yes, Jacques has a question. Jacques, your microphone is live.
Go ahead, Jacques.
Yes, I wanted to know whether Correctional Health has had any problems in getting COVID-19 tests.
So Correctional Health Services has been very fortunate in that we have a good supply of COVID-19 tests. And by good supply, I mean that anyone who meets clinical or exposure criteria for COVID-19 tests will be administered that test and put into medical observation.
Thank you, Dr. Phillips. Jacques, thanks for the question. Do we have another question?
Anna Foot has a question. Anna, your microphone is live.
Hi, I was wondering how the department is responding to requests from the ACLU of Arizona and other advocacy groups for a release of inmates with nonviolent charges to prevent further spread within prisons and jails.
Correctional Health is not responding to any of the ACLU requests. That's not their role in this. I do believe that the county attorney's office will take requests from the ACLU and consider them, and then if that's something that's actionable, they'll take care of that. But I would refer your questions to the county attorney's office. Any other questions?
A question from Dave Biscobane. Dave,
Okay, Dave.
your microphone is live.
So we heard from Dr. Phillips that staff is being screened and sent home if they have symptoms. Do we know how many staff have been screened and have been required to go home, and what is the protocol for the length of time for them to return to work if they do, fail this screening?
That's something, sure. Okay, Dr. Phillips will take that question. Again, the question is, if staff, how are they being screened? And if they seem to be symptomatic in any way, how long are they sent home to recover from those symptoms?
Our health staff are part of a self-screening program for fevers and lower respiratory symptoms. If someone identifies that they have symptoms, then they are asked to go home. They should not report to work that day. As far as the duration of time that someone would need to stay home from work, well, we do ask these employees to go see their medical provider in the community, but in following with the guidelines that have been published by Public Health, it's being symptom-free for 7 days past a positive COVID-19 test, or being asymptomatic, that is no fever, or acute cough or shortness of breath for 72 hours, whichever of those two is longer.
Thank you, Dr. Phillips. Thank you, Dave, for that question. Do we have another question?
Yes, we have a question from Brittany Thomason. Brittany, your microphone is live.
Hi, this is to bounce off the question about supplies, but inside the jails, who are you recommending wear masks? When are you recommending they wear them, and how often are you recommending that they?
And Brittany, to clarify, are you asking, or when you ask who are you recommending to wear a mask, are you talking about inmates?
Inmates and staff there.
Dr. Phillips will address that question.
So this question kind of overlaps into MCSO territory, but I will answer it from a CHS perspective. So when we're talking about our own staff, staff members, CHS who are doing clinical care with patients, we have guidelines in place in the form of standard operating procedures that it depends on the clinical situation someone is presenting with. So if we have a patient who is suspected of having COVID-19 symptoms, then we're going to have a protocol for that. If we have a patient who's asymptomatic and it's a face-to-face visit that doesn't involve a physical exam, we have a separate protocol for that. But suffice it to say that we have sufficient PPE for our staff members, and we have the guidelines out there, and frequently answering questions about exactly what PPE is appropriate and where. When talking about inmates wearing masks, MCSO does have a program in which inmates have been provided with masks, and they are asked to wear those masks when they leave their housing units. And if within their housing unit, they're allowed to wear those masks. From a CHS, and that's really going into more MCSO territory, so they can better answer that question. But when it comes to CHS asking that a patient be masked, it's when a patient is presenting with fever or cough or shortness of breath, that we are going to put that patient on medical observation and make sure that they're wearing a mask and that our staff members are wearing a mask, and that MCSO officers are informed that this person is on medical observation status.
All right, thank you, Dr. Phillips, and thank you for that question. Do we have another question?
I have a question from Griselda Zatino. Griselda, your microphone is live.
Go ahead, Griselda.
Okay, we'll take a question from Allison Steinbach. Allison, your microphone is live.
Hi, this is a question for Dr. Sunenshine. It's about testing. So what does it mean that there's an 8-day reporting delay from when test specimens were collected and when they were reported in county numbers? So what causes the delay beyond the 3 to 5 days for test processing? I just want you to describe the route a test takes from the clinic to the state to the county.
Okay, thank you for that question. The route that the testing is taking, because we know it takes a certain number of days or hours to process that test, and then when does it arrive in our reporting structure? So I'll let Dr. Sunenshine address that.
So first, I just want to clarify that it takes up to 8 days for that test result to get recorded in our data. So that's really the longest that it would take. And it very much depends on which laboratory the particular healthcare provider or healthcare facility is using. Also, it depends on whether it's coming from an outpatient provider who might collect the specimen, and then it may take some time before they can get it packaged and sent on to another provider. Whether the commercial laboratory that they are using has a laboratory located here in Arizona, or whether it has to go maybe to California or even across the country. That shipping takes quite a bit of time for the specimen to arrive. If it's going to the state laboratory, it tends to be a little bit quicker. Once it gets to the laboratory, that depends on what type of test is being done. But for that typical CDC type PCR test, It usually can be done that same day, but again, getting all of that turned around, batching of results. Sometimes if there's only a few specimens from a particular provider, they'll wait until there are multiple specimens to go into a batch. And then it has to be turned around, sent back through the state electronic laboratory reporting system, and then it is put through another system into the Maricopa County Health system, where we can pull that and get that information included in our data. So it's a little bit complicated, but that's why it can take up to 8 days, but sometimes we have those results as soon as a few days.
Thank you, Dr. Sunenshine. Do we have another question?
This is a question from Matt Rodewald. Matt, your microphone is live.
Yes, hi. This question is for Dr. Sunenshine. Plans swirled late last week in regards to resuming Major League Baseball at some point in May. Two very floated proposals indicated games being played in Arizona next month. Now, this might require having thousands sequestered in hotels in Maricopa County. Based on your suggestion of the peak of cases being quite possibly late April or early May, do you think it's safe for MLB officials to consider games being played as early as May here in Maricopa County?
Dr. Sunenshine is willing to answer part of that question. So let me just be very clear, though. Maricopa County owns Chase Field. Most people know that. The Diamondbacks are the facility operator. We do not officially have any sort of comment on Major League Baseball's business decisions or business proposal in this case. However, from a public health standpoint, I believe Dr. Sunenshine can address this discussion about whether or not you bring people from out of state and put them up in hotels, which I think is the base of that question.
Thank you, Fields, for starting that question off. There's a few different pieces here. One is that in general, restarting Major League Baseball would fall into the category of being willing to have fans come back together in large gatherings. And right now there's an executive order that prohibits gatherings of greater than 10 people. So for one thing, we would have to, of course, wait for the governor to lift the executive order to ban gatherings of greater than 10 people. Regarding the timing of that, I think it's really tricky to tell at this point. We're all thinking that the peak may be around early May, but the better we do social distancing, the longer it will take to get to the peak. So it could even be delayed after that. Most of us think that once you get to the peak, that you have to maintain social distancing practices for at least a little while to make sure that we don't pull off too quickly and then have a second resurgence of cases. So we'll be watching very closely once we hit the peak and we get back down. I think that is when people will start to make recommendations that you can resume larger gatherings, but the timing is very difficult to predict.
All right, Matt, thank you so much for your question. Anybody else, Chad?
Yes, Dave Biscayne has a follow-up. Dave, your microphone is live.
Yeah, with my previous question regarding the number of officers and how they're screened, I just wanted to understand, one thing that I asked is, do you know how many have been asked to go home? Do we know that number?
And we're talking about detention officers, correct?
Correct.
We don't know that number. That would be a question to send to the communications team over at MCSO. And to be clear with everybody, Correctional Health Services is not responsible for the health care of our detention officers. Obviously, these two groups work well together. They work in tandem together. But Correctional Health Services is there for the health and well-being of the inmates who are in our jails, no matter how long a period of time that is. So detention officers have county health insurance plans or plans from somewhere else, and they're welcome to see their health care providers. Do we have another question, Chad?
Yeah, we have a follow-up from Hannah Flip. Hannah, your microphone needs to be unmuted on your end, please. I guess we'll go ahead and move on to Brian Webb. Looks like the same issue from Brian. Allison.
I'm here.
Oh, okay, Brian, go ahead.
I feel one more for Dr. Sunenshine, please. She brought up recently about peak cases and knowing when to possibly scale back social distancing, doesn't that require enough testing to track these cases case by case? And does she predict we will have enough tests at the beginning of May to do that? Thank you.
Okay, so the question is the requirement for social distancing, which again, that's a governor's executive order at this point, and also testing and how those two things, is testing the requirement that we need to end an order or a recommendation for social distancing? Dr. Sunenshine?
So I'm glad you brought that up. I think that the perception that we need to be able to track every single case of COVID-19 in the county to understand where we are in our epidemiology curve and when we've reached the peak and when to pull back on social distancing measures. It's actually not dependent on being able to know every single person who's infected. In fact, almost every disease that we look at in public health, we don't have complete information. Typically, the most severe cases of any disease are tested and reported to public health. So what we do in public health is we follow the trends of the most severe cases, and in that case, that's the individuals with COVID-19 who are hospitalized. And by following those trends, they are not dependent on testing availability because hospitalized individuals have always been able to get tested. And so we're following that epidemiology curve to know when we've reached, when we're well past it, and when we would all be comfortable pulling back on social distancing recommendations.
Thank you, Dr. Sunenshine. Is there another question, Chad?
Yes, Jimmy Jenkins has a follow-up question. Jimmy, your microphone is live.
Once again, can you describe to us what the quarantining situation is like? What kind of steps are taken to separate and quarantine people? And has there been any thought of utilizing the new intake facility to do some of that separation?
So you're talking specifically about medical isolation inside the jail system, correct?
Yeah, that would be great. Just any information at all on that would be great.
Okay. So Dr. Phillips, can you answer that?
Yes. So I can explain the process from the Correctional Health Services standpoint as far as putting people in medical observation. The question about using the new intake facility is really a question for the Sheriff's Office. So what happens when a member of Correctional Health Services, a nurse or a provider, identifies someone with symptoms that may be consistent with COVID-19, that is a fever, cough, or shortness of breath, or even a credible exposure to COVID-19 in the community, an order is written by a medical provider for medical observation, and the inmate patient is moved to the medical observation unit. And there are several of those units inside the jail. And within those units, both CHS and MCSO staff, they interact with these inmate patients regularly, and they're monitored for the duration of time that they need to be in there. Inside these units, CHS staff will be doing temperature checks daily on these individuals, as well as checking for symptoms of cough, shortness of breath, and their overall clinical status. And it's also within these units that COVID-19 tests are done. So, just let that be.
All right, thank you, Dr. Phillips. And Jimmy, I know you mentioned the new intake transfer release facility. Obviously, that's a very large facility that was planned to be open this month. That opening is on hold at this point. We're very aware of that. We're also very aware that our average is between 7,500 and 8,000 inmates inside the Maricopa County jail system. And at this point, we're down around 5,500 because of the measures that have been mentioned in this press conference and previously that have been put in place by the courts as well as the county attorney's office. And so our inmate count is quite low right now. So we do have space to create these isolated systems that Dr. Phillips was mentioning. Is there another question?
Yes, Allison has a follow-up question. Allison, your microphone is live.
Thank you. I'm just curious why the county switched to the PDF for the daily data updates.
I'll let Dr. Sunenshine address that. So why we switched to a PDF as opposed to we were doing an embedded JPEG, I believe, or something. If we're getting technical about the website right now, I'll let Dr. Sunenshine address that.
So the answer to that is that we're continually getting requests for more and more information, and switching to the PDF format allowed us to provide a lot more information on a daily basis so that we can be as transparent as possible with our data.
Is there another question, Chad?
Looks like we have one more question. It's from Hannah Foote. Hannah, your microphone is live.
Hi, while I have you, a panel of health experts recently wrote to the State Corrections Department in Arizona and 27 other death penalty states, seeking sedative and paralytic drugs to help treat COVID-19. As I understand it, Arizona has not used these specific drugs in execution since 2014. Can you confirm that and tell us how the department plans to respond to the letter, if at all?
So Hannah, you were kind of breaking up there, but you were talking about paralytic drugs, I believe, to help people deal with this disease or deal with the symptoms. Can you repeat that part of your question?
Of course. A panel of health experts were asking state departments of corrections, including that of Arizona, to release sedative and paralytic drugs to help treat COVID-19 to medical personnel. And I was wondering how the Department of Corrections in Arizona is responding to that, or if they plan to respond at all.
Okay, to be clear, we're Maricopa County. We're not a part of the Department of Corrections. That's the prison system here in the state of Arizona. So I'd have to defer your question to them about that. As far as I'm aware, we did not receive that. And as Dr. Phillips already mentioned, we have 0 cases in the jails at this time. Are there any other questions?
There are no more pending questions, Phil.
All right. I'd like to thank everybody for joining us today. Monday, April 13th, we will have another press conference sometime later this week. We'll let you know via media advisory. But thank you so much for being with us today. And you can always email caomedia@maricopa.gov, and we'll assign your question to a PIO here in the Joint Information Center and get you an answer as quickly as possible. Thank you very much.